Hello and welcome to our channel. Have you ever wondered how healthcare professionals interpret chest x-rays? Whether you're a medical or nursing, a radiology, or someone curious about health imaging, you've come to the right place. Today we'll break down how to interpret a chest x-ray, step by step, in a way that's simple, yet comprehensive. Before getting into the topic, kindly subscribe to our channel to get more updates and knowledge. Let's dive into the session. Chest x-rays are one of the most common diagnostic tools used by doctors around the world. From detecting lung diseases to identifying heart conditions, a chest x-ray provides us with critical information. But if you've ever looked at one and felt overwhelmed by all the details, you're not alone. In this video, we'll walk you through the process of interpreting a chest x-ray, focusing on key areas that can reveal vital clues about a patient's health. First things first, let's take a quick look at the anatomy of a chest x-ray. Typically, a standard chest x-ray shows the lungs, heart, ribs, and diaphragm. On a well-positioned x-ray, you'll also see a clear view of the trachea, main stem bronchi, and various blood vessels. Understanding this basic anatomy is crucial because it helps you identify what's normal and what could indicate a problem. Now let's break it down into actionable steps you can use to interpret any chest x-ray. Step 1. Quality of the x-ray. Ensure clarity. The first step in interpreting a chest x-ray is to assess the quality of the image. Is the image clear and well exposed? A poor quality x-ray can make it difficult to spot important findings, so always check the following. Positioning. Is the patient positioned properly? A common mistake is an x-ray taken while the patient is leaning, which can distort the image. Exposure. Are the lungs well visualized? If the image is too dark or too light, it may not give you the full picture. Step 2. Systematic approach. Break it down. Next, let's dive into the systematic approach you'll use when interpreting a chest x-ray. Remember, following a methodical approach ensures you don't miss anything important. I like to break it down into 4 key steps. Look at the bones, check the ribs, clavicles, and spine for any fractures, signs of infection, or abnormalities. Examine the lungs. Look for any changes in lung density, which could indicate pneumonia, lung cancer, or fluid buildup, like in congestive heart failure. Inspect the heart. A normal heart size should be about half the width of the chest cavity. An enlarged heart could indicate heart disease. Check the diaphragm. The diaphragm should be smooth and well-defined. A raised diaphragm can be a sign of lung disease or diaphragm injury. By taking a focused look at each of these areas, you'll be able to detect abnormalities early. Step 3. Common abnormalities. What to look for. Now let's talk about the common abnormalities you might encounter on a chest x-ray. Consolidation. If a portion of the lung looks whiter than the surrounding tissue, it could indicate pneumonia or fluid. Pneumothorax. This happens when air leaks into the pleural space, causing the lung to collapse. It often appears as an area of black space where the lung should be. Cardiomegaly. An enlarged heart may be seen with certain heart conditions like heart failure. Fractures. You may notice rib fractures, which can be subtle and easy to miss, so always zoom in on suspicious areas. Knowing what to look for is half the battle. Once you recognize these signs, you'll be able to pinpoint potential problems more efficiently. Step 4. Using clinical context. Contextualizing the x-ray. Remember, a chest x-ray is just one part of the puzzle. You must always interpret it in the context of the patient's history and symptoms. For instance, if a patient presents with a cough and fever, an x-ray showing consolidation in the lung could confirm pneumonia. However, If a patient has chest pain and shortness of breath, you might consider a pneumothorax or pulmonary embolism. Without clinical context, you're just looking at an image. Always integrate the X-ray findings with what the patient is experiencing to make a more accurate diagnosis. Step 5. Let's see a clinical scenario. Let's take a quick look at an example. Here's an X-ray of a 60-year-old patient with a history of smoking and chronic cough. Upon reviewing the X-ray, you notice a mass in the upper right lung, which could indicate lung cancer. The patient's history combined with this finding suggests further investigation is needed. By systematically reviewing the image, considering the clinical history, and focusing on key areas, you can make an informed interpretation and guide the next steps in the patient's care. Conclusion and call to action. And that's a wrap on our chest X-ray interpretation guide. Remember, practice makes perfect. The more you familiarize yourself with chest X-rays, the easier it will be to spot abnormalities and make accurate diagnoses. If you found this video helpful, give us a thumbs up and share it with anyone who might benefit. For more tips and guides on radiology and medical imaging, don't forget to subscribe and hit the notification bell so you never miss a new video. Have questions or want to see more examples? Drop a comment below. We'd love to hear from you. Thanks for watching.